Hi, I wanted to talk to you today about clinical hypnosis and trauma treatment. Many of you wrote in questions that were really good questions. And so, to start, I do want to cover a little bit about trauma treatment first, because clinical hypnosis is just a tool that we utilize for the treatment of trauma. It is not a treatment for trauma. It is a tool that we use with many other things to treat trauma. So, the first thing I just want to say about trauma treatment is that it is phase oriented. And what that means is we really try to start with the first phase before you ever even get to talking about or processing trauma or traumatic memories is we want to focus on your ability to be able to manage your emotions that come up when thoughts of the trauma are in your mind. When you look at PTSD, post traumatic stress, we people get triggered. Their trauma gets triggered, and then they have emotional reactions to that trauma. And that creates the avoidance that we see with PTSD, where people want to avoid things that trigger them. And that can be many different things or a few things. So first, in trauma treatment, we want to be able to teach people to manage the emotions that come up when they get triggered or when they are thinking about the traumatic memories or traumatic material. So as far as length of treatment, that varies greatly on individuals, on the type of trauma, on a variety of issues, comorbidity with other diagnoses, and the defenses that a client utilizes to cope with trauma. So that can vary greatly from a few sessions to years of therapy. So, I already mentioned hypnosis is a clinical tool. It's used to help with during all phases of treatment and all many different symptoms. It can be used as for managing symptoms, for strengthening ego or self-esteem. It can be utilized for exploring the unconscious mind. We typically don't use hypnosis to look for memories because memory is a complex issue. We don't just record our memories like a video recorder. So we have to be very careful because we don't want to have clients remember things that aren't there or to not remember things that were there, or we just have to take a really cautious stance with regards to memory. So we don't use hypnosis to uncover memories. We might use clinical hypnosis to figure out a symptom that doesn't have a known cause. And sometimes when we are chasing that symptom and exploring the unconscious, we memories may come up. Things may come up that aren't necessarily inaccurate, but we can't be for sure that they are totally accurate either. So, hypnosis can be used to improve sleep. There are hypnosis strategies to help with nightmares. There are hypnosis strategies to help with mastering the material of trauma so that you can get kind of desensitized to the intense emotional reactions that you have with thinking about the trauma. Um, there are ways of managing flashbacks and intrusive thoughts, like turning off the trauma in your mind. And then probably the biggest hallmark that you're learning about is that there are ways to regulate affect, and many hypnotic skills are very useful in affect regulation. And then there's a whole treatment model therapy called ego state therapy that is extremely beneficial when combined with hypnosis in utilizing that approach with people who have complex trauma, childhood trauma, or dissociation, like dissociative identity disorder. So now that I got that covered, I want to talk about your questions, and let me access them. One of the first questions was, how does the person performing hypnosis, how are they able to tell that someone is in a hypnotic state? Excellent question. Well, we have a thing called trance ratification, a term. And trance ratification is actually something that would show you that you are in trance if you are the one being hypnotized. So, for example, many people can be in a trance and it just feels like a comfortable state of focus. They're very focused and very absorbed, and they'll say their body feels very relaxed. Not all hypnosis is relaxing, however. It can be, there's alert hypnosis. People go into trance when they perform, um, you know, perform music. Musicians use trance, athletes use trance. So there are many different types of trance. We do utilize the power of suggestion, and suggestions are more acceptable when in a trance state. So we utilize your susceptibility for trance as well as your suggestibility. And yes, some individuals are more suggestible than others. Someone had a question about his clinical hypnosis used with kids. Kids are wonderful subjects for hypnosis. They often don't even have to be in a hypnotic trance because kids are also extremely suggestible. Um, for example, depending on the age of the child, if they are in the times of imaginative thinking and imaginative play, kids can utilize all kinds of things creatively to help with conflict. That's why, if the power of a kiss when you have an owie and the child will say, I need a kiss, and the kiss makes it feel better. Does the kiss really have magical healing powers? Perhaps, but it's the suggestion that the kiss will make it feel better, and the child believes the suggestion, and the kiss does indeed make it feel better. So there are, back to the question, what is trance ratification? How would you know you're in trance? Well, we have certain scales. On a scale of 1 to 10, 10, you really feel you're totally immersed in the experience. 1, you feel like not really any different than we started. We can ask what number a client is at, and you can talk during a hypnotic state. But quite often we just observe hypnotic phenomena, and we observe an individual responding to our suggestions for trance. So if I see someone fluttering their eyes like this, and I make a suggestion, that's right. Notice the flutter in your eyes and how your eyelids are getting heavier and heavier. It may feel that your eyes want to close. That's right. Just close your eyes and allow yourself to settle into this experience. Something like that. We respond. You noticed I was responding to my own suggestions. As I talked about the flutter in my eyelids, I gave a suggestion for them to feel heavier. And as they felt heavier, and I gave a suggestion that they could close. And when they close, I would comment on them closing. So we notice and observe what we call hypnotic phenomena. Now, a trance ratification is just for the client to experience that hypnotic phenomena themselves, rather than just be told about it. So if I have a client with their hands folding together, I might talk about their hands being comfortably folded together. And they may feel so comfortably folded together that it would be difficult for them to pull them apart. Certainly they could pull them apart, but they may feel so comfortably placed that they want to stick together. Now, when I give the client a suggestion that they could pull their hands apart, they immediately try. And they may be aware that they're so comfortable and heavy that they don't want to come apart. Clinically, that's useful to show the individual that there is something happening, that they are in a hypnotic trance, and that their body responds to suggestions. So if your body can respond to a suggestion for your hands to be stuck together, imagine the suggestions it can respond to that might be healthy for healing or to manage your trauma. So let's look at another question. Clinical hypnosis certainly can work on all patients, but there are some clients and patients that are more hypnotizable than others. People who have a lot of complex trauma have a history of dissociating, and clinical hypnosis is a way of dissociating. You know, we dissociate from everything else and focus in on one, we narrow the focus. So there is, a component of dissociation to hypnosis. So people who dissociate and have dissociated often to survive trauma, they're utilizing hypnotic phenomena. So they're already good at it. Quite often we have to work on re-alerting because they're so good at going away. We need them to stay present. So why aren't more people utilizing clinical hypnosis? Well, it is expanding, and quite often when people utilize it, they can see the power of clinical hypnosis, but we don't advertise it. We don't market it. We are clinicians, and it's just a tool we've been trained to use. And so I guess the answer to that is, like, we're not a biological treatment that big pharma is pushing. You know, we don't make money off of clinical hypnosis. It's just a tool for treatment that we're utilizing and earning a living off of already. So nobody's capitalizing on that use of clinical hypnosis. It's just a tool to enhance treatment. Certainly, it's a really effective tool, and I can't imagine doing my practice and not having clinical hypnosis to help clients, especially with anxiety disorders. Okay, another question. How's meditation and hypnosis comparable? Very good question. And both are wonderful ways of kind of regulating the autonomic nervous system. I don't know that one is better or more successful than the other, but clinical hypnosis is much more broader in that we have a specific application that we're going to utilize the capacity for trance and suggestion. Meditation is just letting go, or being mindfulness is being very mindful and narrowing your focus on the present and what's going on around you. Meditation is perhaps of clearing out the mind and just being in a space that is comfortable and experiencing that comfortable space. Certainly that's therapeutic and can be therapeutic for many different things. Hypnosis takes it a step further, because once you get in that space, there are all kinds of applications, not just for trauma, but as you learn, for many other kinds of things. Another question is, what kind of schooling, or how do you learn hypnosis? Certainly, I was trained, and you want to be trained if you go into the field of clinical hypnosis, meaning you're going to utilize hypnosis in a clinical way, not for entertainment purposes, which has some concerns. And when we use it clinically, we are trained to use it for the things that we already treat clinically. So we're just adding hypnosis to what we do already clinically. There are a number of organizations that have training, but you want to certainly be trained by an organization that only treats those using clinical hypnosis, such as the American Society of Clinical Hypnosis. Can clinical hypnosis be harmful in any way? Clinical hypnosis is not harmful in and of itself, but I want you to explore remember, clinical hypnosis uses the power of suggestion. Certainly, the power of suggestion can be used for healing and enhancing well-being and helpful ways. But the power of suggestion is often used in more sinister ways. Certainly, hopefully not in psychotherapy, but in cults. The power of suggestion is used in advertising. Power of suggestion is used in abusive relationships. So suggestion is used in many different areas. It's not clinical hypnosis that causes harm. I think when it is used in the wrong way, it certainly can be harmful, but that's because maybe someone is not aware of who they're working with, and they bring up traumatic material that they're not trained to manage the emotions that come with that trauma. Or a client in a hypnotic state has a bad experience because of something they went through, and then they are left destabilized. And so those kind of things we have to be careful for. And entertainment hypnosis, or the lay hypnosis person who is advertising, hypnosis for weight loss, sometimes they're not trained in all the field of psychological ramifications and things that can come up, like trauma being triggered. So we want to be careful of that. And if you're going to utilize clinical hypnosis, make sure you use it from somebody who's trained to treat what they're treating and also trained in clinical hypnosis. Otherwise, hypnosis is a lot safer than some of the medications that are prescribed for anxiety. Certainly, there are medications that are dependent and can certainly cause addiction. We're looking at new ways because of the opioid epidemic to involve hypnosis for pain management, and it certainly can be useful in pain management. But again, it is one tool in the treatment of pain management. So, can clinical hypnosis treatment be measured? Well, we measure outcomes of treatment. People have treatment goals. How are they doing? Are they getting better? Are they sleeping better? So we can measure the outcomes of treatment. And again, hypnosis is not a treatment, it is a tool to be utilized with treatment. Hypnotic trance, there are different scales in measuring hypnotic susceptibility, but I'm not going to get into all that. Those are used quite often for research to determine who's a low hypnotizable, a moderate hypnotizable, or maybe a person who's in a high hypnotizable. What about the person's openness to the treatment of hypnosis? Certainly, we only want to utilize hypnosis if someone's open to that treatment approach. People can be very guarded and still go into trance. And quite often with trauma treatment, we want to be very careful because vigilance and hypervigilance is often a defense. And so we don't want to take away someone's defense or they're going to get more anxious. So sometimes kind of going into a relaxed hypnotic state can be met with increased anxiety because people are afraid of kind of letting go and feeling that comfortable, because that has been a sign of danger in the past. So when that happens, quite often we will use language like, you can hang on to whatever vigilance you need in order to feel safe and manageable, or to let go of however much anxiety is comfortable for you to let go of. We just kind of tailor the language a bit. All right, what other questions do we have here? I'm sorry if I'm not looking at the screen because I'm reading questions and then looking at the film. So some people are more open and easier to hypnotize than others. I covered the vigilance question. Someone was confused, like, can clinical hypnosis actually heal an injury? Clinical hypnosis isn't going to heal an injury, but clinical hypnosis certainly has been used for a number of different things, because the mind and body are connected. And so clinical hypnosis can, raise the or lower your temperature. Clinical hypnosis can your body temperature. So it's been useful in the treatment of burns. It's been useful because we can distract and get your thoughts absorbed somewhere else. So then you're not perceiving pain in the same way you would otherwise. And there's been brain scans to look at that. Something interesting, if you Google Snow World, it's a tool that was utilized. It's more of a virtual reality kind of treatment, but the thought of it came from what hypnosis can do and how powerful the mind is. So Snow World and the treatment of burns, Google it and you'll find some interesting things. And certainly hypnosis can be helpful in providing comfort, in enhanced healing for sure. Can even stop the flow of blood with hypnosis or slow the flow. So certainly that can be beneficial. And there are it's been used for anesthesia, where people who can't have anesthesia. When I go to the dentist, I only use self-hypnosis. I don't get Novocaine because I don't like the needles and the numbing, and I will utilize self-hypnosis to put myself in a comfortable place and let the dentist work on my teeth and mouth. I'm consciously aware I'm in the dentist office, but I'm also somewhere else. Power of suggestibility does play a great role in hypnosis therapy. If the therapist suggests something that a client doesn't want to do, they're not going to do it. We look at clinical hypnosis as a place the person allows themselves to go. So, yes, there's a relational component, but we really want to promote safety and the feeling that it is something that they are in charge of. They are in charge of how deep they go. They are in charge of what they'd like to do there. They are in charge of how they come back. And certainly we guide and reorientate them and assist them in that process. Someone said, "How is it different from dissociation?" And I think I already covered that. That certainly it's not all that different. I train people to dissociate when we are utilizing hypnosis, and we want to dissociate in an effective way. So quite often with trauma, clients are people who have severe dissociative disorders. I might be training them to dissociate in a way to dissociate from the trauma, not from themselves or not from another part, so that they don't have to fragment and separate themselves, but they can dissociate from the trauma. They can put the trauma further away. So hopefully that makes sense. Clinical hypnosis is very effective. Remember, it's not hypnosis therapy. It is a tool that is utilized. So, when we do trauma treatment, hypnosis is just one of our tools that we utilize, and we utilize it in conjunction with psychoanalytic theory, changing cognitive thoughts, and all of the other kinds of components. And it can enhance all those different psychological perspectives as well. I already mentioned that it's certainly very effective with children. Children often have more alert trance. They like to, an adult might want to go to a comfortable, peaceful place that's tranquil and quiet. A child might want to go to an amusement park in their mind, and children are full of imaginative um, thoughts and creative solutions. So, um, clinical hypnosis is very affordable. Again, it's just a tool. Most therapists and clinicians don't bill for hypnotherapy, they bill for therapy. And hypnosis is just one tool they're utilizing in therapy. So, certainly, if you have a diagnosable mental health condition or a trauma related disorder, your insurance is going to cover that. So, hypnosis, if you're seeing someone who utilizes clinical hypnosis, it's beneficial. The other thing I want to say about you learned about EMDR, and EMDR is often not recommended for people with severe dissociation symptoms, such as dissociative identity disorder, because it unravels their defenses too quickly. So, clinical hypnosis can be utilized in a much slower, gentler fashion, in a way that doesn't cause that destabilization that sometimes we see with EMDR, with complex trauma. Certainly can be effective, but you have to really know what you're working with when utilizing it. And I think that summarizes most of the questions that were asked. And this video is getting longer than I intended. So thank you for your interest in clinical hypnosis. I hope I answered your questions effectively. If something didn't come across clear and you still have a question, please email me and reach out. I'd be happy to answer it for you. Thanks.